Imagine yourself taking your loved one to the hospital and leaving for the night. You later return and your loved one has passed away. You later find out the passing away of your loved one was due to a medication error. I work at a hospital where I have witnessed two medication errors. The first one was due to a patient that was hyperglycemic, received too much of the wrong insulin, and became hypoglycemic and passed away. And the second one was due to a patient that received contrast dye. She was already in kidney failure and she also passed away. According to Cuisine 2014, the implementation of automatic drug dispensing system resulted in 53% reduction in medication error and risk reduction for the patient. Key terms: medication dispensing cabinet. That is a machine that stores medication and supplies in hospitals or other healthcare facilities. We as nursing students should want to keep our patients safe. So today, I'm going to inform you of why the medication dispensing cabinet is important from 1, the nurse perspective, 2, the pharmacist perspective, 3, the Joint Commission perspective, and 4th, the patient's perspective. First, the nurse perspective. According to Fanning 2016, nurses consider automatic dispensing cabinets has made their job work easier and helps to provide safe patient care and reduce medication error. The reason why the nurses think that their jobs have been made easier by the medication cabinets is because they're able to gather a lot of medications at one time. Also, the narcotics are safe because they're in a medication dispensing cabinet, and also the patient trusts them because they're at the bedside with the medication, asking the patient to state the name and date of birth to verify this medication is for them. Second perspective is the pharmacist perspective. According to Peterson 2015, improving patient safety is a key focus in the hospital setting. The pharmacist perspective think it's more convenient because they're able to provide more medication at one time, is less risk reduction, and also the nurses are taking accountability for the medication they take out the dispensing cabinet. Third, there is the Joint Commission perspective. According to Trainer 2018, one of the big problems with automatic dispensing cabinet is that sometimes staff overriding without having an order. When the Joint Commission comes to the hospital, they want to know which staff overread the system, why, and how many times he have done it because they find a facility. Also, they enforce the rules. They make sure that all medication are stored properly, how it's supposed to be. No medication is just dangling on the floor in the nurses' cows. Also, they have a 2019 Hospital National Patient Safety rules. So this is the Hospital National Patient Safety Goal according to Joint Commission Accreditation Hospitals of 2019. The purpose of the National Patient Goals is to improve patient safety. The goal focuses on problems in the healthcare safety and how to solve them. So this is the medication aspect. So basically, the first one says that if the patient is having a procedure, all medication must be labeled properly. The second one is if the patient is taking blood thinners, that the nurses and staff needs to be aware of the patient safety. And the last one is basically about education. It's telling you, make sure you record accurately, make sure that the patient knows what medication is to be taken at home, and when and where, and making sure that the patient also have an up-to-date medication list every time they come to the hospital. So the fourth perspective is the patient perspective. According to Richard Ho, patient harm is classified by a 5-point system. The 5-point system is either severe, moderate, or mild. And then the next one is death and no harm. The severe, moderate, or mild can be corrected, but the death cannot be corrected because the patient is gone. And no harm is when like a nurse or a doctor draw up the wrong medication or the wrong amount, even if they don't harm the patient. So the patient want to be able to trust the staff. They want to know when they bring their loved one to the hospital that their loved one is okay and in safe hands. And they want to make sure that all nurses are following the safety protocols. So in short, I have informed you today of the medication perspective, medication dispensing cabinet from 4 different perspectives: the nurses, the pharmacist, Joint Commission, and the patient. To me, the most important tool from my perspective, from me, the most important tool perspective is the nurse and the patient. I think the nurse's perspective is important because their license is on the line, number one. Also, a medication error could cost them their job. And they also want to make sure that the patient trusts them. And from the patient point of view, the patient perspective, they want to make sure that they're able to trust the hospital. I was a patient before, and I want to make sure that the nurse is giving me the right medication. So we as nursing students need to make sure that we are aware of what medication, make sure we take accountable for the medication, and also that we'll follow all hospital protocols. Thank you.